it's reassuring to see that a gut intervention, probiotics, can help to start decreasing depression, activation of certain centers within the limbic system, in this case, hippocampus, and that leads to some improvements in memory function. Hey everyone, this is Dr. Ruscio. Welcome back for more updates on probiotic research. And boy, is there a whole lot we can learn. In this case, a number of studies I'd like to share with you on probiotics for brain health, metabolic health, body composition, and infection. We'll touch on cognition, depression, autism, liver health, blood pressure, weight loss, muscle mass, COVID-19, and oral dysbiosis. Alrighty, let's jump in and start with brain health. And specifically cognition, a randomized control trial in 43 individuals who had major depression and a degree of cognitive impairment. And remember that many of the centers in the brain, specifically within the limbic system, which includes hippocampus, thalamus, hypothalamus, and amygdala, are often overactivated in depression and or when memory is impaired. So in this trial, they administered either probiotic or placebo. And the probiotic was Visbiome, essentially a blend of lactobacillus and bifidobacterium at a high dose, 900 billion per day, which is more than most people will need. But nevertheless, that's what they did. After 1 month, they found improvements in short-term memory. However, no improvement in long-term memory. Short-term memory, aka working memory, is the ability to hold data in your mind for a short term. It might be a new name, it might be a grocery list, it might be when you're trying to solve a problem and you're holding multiple pieces of data in your mind looking for a solution. So while long-term memory is nice, short-term memory also has a lot of applicability. Now, what is so fascinating and so elegant about this study in particular, they also looked at hippocampal activity through functional MRI. And here is what they found. Now, what you're looking at is the orange bars are the placebo group. The blue bars are the probiotic group. The orange bars going downward are denoting activation of the hippocampus. The blue bars, the probiotic intervention group, going upward indicate a reduction in activation of the hippocampus, leading the researchers to conclude, quote, commonly, the hippocampus appears hyperactive in patients with depressive symptoms. The hippocampal deactivation over time in the probiotic group is assumed to reflect the beneficial effects of probiotics on depression-related cognitive impairment. So more and more data pouring in showing us that the gut connects to the brain, and specifically centers in the brain in the limbic region, in this case hippocampus, but we've also discussed other studies showing a decrease in amygdala activity. Why this is important is it does seem that perturbations in mood, namely depression, and impairments in cognitive function tend to operate or occur together. And so it's reassuring to see that a gut intervention, probiotics, can help to start decreasing depression, activation of certain centers within the limbic system, in this case, hippocampus, and that leads to some improvements in memory function. So really great study here. This next study, a systematic review of 7 randomized control trials, wanted to look if probiotics could improve depression. They looked at placebo versus probiotic. And in this case, the dosage varied from 100 million to 900 billion. So a big range of dosages used. And mainly they were using, or the studies administered, lactobacillus and bifidobacterium blends. What did they find? After 1 to 2 months, probiotics did not improve depression or the gut microbiota. Now, upon closer scrutiny, you do see an interesting trend that in the studies where probiotic dosages were less than 2.5 billion, there was no correlation to improvements in depression. However, when the dose exceeded 20 billion, there was improvements demonstrated in depression. And again, the ranges here varied widely. So the jury, in my opinion, is still out regarding the impacts of probiotics on depression. I wouldn't hang my hat on it saying definitely going to be helpful. I also don't think there's enough evidence one way or the other to conclude that they're not going to be helpful. And the dosage might be a factor, and or what's going on in someone's gut at baseline. It might be that people with no GI imbalances, dysbiosis, overgrowth, inflammation, leaky gut, those people with none of that present may not see a benefit for depression because their depression may be due to other factors. But, and I'm speculating here, but I think this is a reasonable speculation, for those whom do have some degree of GI symptoms, gas, bloating, constipation, loose stools, diarrhea, GERD, reflux, abdominal pain, and have depression, brain fog, anxiety, this might be the cohort who is best suited to benefit from probiotic supplementation for impairments in mood and or memory. This next meta-analysis looked at 7 randomized control trials in 268 kids who had autism, control versus versus probiotic. And the probiotic varied from lactobacillus to bifidobacterium to enterococcus. The dosages also varied, but nevertheless, summarized in this meta-analysis, they found that when pooling for all of the probiotics included, there was no effect on autism. However, when they looked at multi-strain probiotic formulas, they did find an improvement in behavioral symptoms, whereas single-strain probiotics had no effect. And what might be happening here is if there is an immune implication in the behavioral disorders, we might need a multi-species probiotic with an ability to trigger more of a multitude of these gut receptors in the gut, toll-like receptors, pattern recognition receptors that influence the immune system. That's my speculation, but that might be how we account for the fact that a multi-species probiotic improved behavioral symptoms in autistic kids, whereas a single strain probiotic did not. Now, coming to the question and kind of the debate, multi-strain or multi-species probiotic versus single. Here are 3 of the most recent meta-analyses looking at multi versus single species probiotics for IBS. And the trend that you see is a favorability toward multi-species or multi-strain probiotics as compared to single. This is not a conclusive trend. It is debatable. But when we look on the macro or meta view, about 2 of 3 of these meta-analyses concluded multi is better. So there does seem to be a fairly obvious trend line favoring multi-species or strain probiotics as compared to a single strain. So what that means is you could have, and you'll see some of the studies we'll cover later, looked at one probiotic, maybe Lactobacillus plantarum. And as exciting as that one study can be, I do think it's important to look at that in the wider context of multiple studies across multiple conditions and look for what is the greater trend suggesting. And we do see, at least looking at these datum for IBS, that a multi-strain, so you would have Lactoplantarum plus Lactoacidophilus plus Bifidobacterium acidophilus, or Bifidobacterium brevis rather, you'd look for on the back, on the label of the bottle, multiple different bacteria rather than just one. By the way, if this is helpful, please like, comment, or share. This really helps us understand what you guys want to know more about with the comments, and also helps us reach more information with practical evidence-based data on probiotics for improving one's health. Okay, coming over to metabolism and body composition, a few really interesting studies here. This next study, meta-analysis, 21 clinical trials summarized, looking at over 1,000 individuals. And this very interesting compilation of research looking at non-alcoholic fatty liver disease. So people often in our consulting practice will ask, what do I do about elevated liver enzymes? One thing that can be done is the use of probiotics. So this meta-analysis looked at control versus probiotic. And again, the probiotic formula, looking at 21 randomized control trials, as this meta-analysis did, varied, including lactobacillus, bifidobacterium, streptococcus. with variability in the dosages, telling us that you have flexibility with the formula that you use. They found a reduction in hepatic or liver fat content, a reduction in liver enzymes, including ALT and AST, and also a reduction in triglycerides. Now, importantly, and a concept that we've hit on before, is the best improvements in liver function seem to be hit when using 3 months or more of supplementation with a probiotic. So it's important to keep that in mind. My view on this is you should see some sort of symptomatic improvement within about a month, but we're seeing more and more studies come in showing that the peak or the pinnacle of improvement may not be achieved until the second or third month of supplementation. And I also wanted to share with you some of what the research is elucidating regarding the mechanisms. Now, we know that about 35% of individuals with non-alcoholic fatty liver disease have SIBO. And as this paper from Frontiers in Endocrinology does a very nice job of laying out, SIBO can lead to leaky gut or hyperimpermeability of the intestines. And this can lead to hypersensitivity to endotoxin and this whole sort of inflammatory cascade that we discussed in the before, bringing back in toll-like receptors 1, 2, and 4, which can trigger inflammation and the activation of the immune system, part of which the liver helps to clean up. So this is likely why we see not only a correlation between 35% of those with non-alcoholic fatty liver disease having SIBO, but also, as this study demonstrated, administration of probiotics can reduce the liver enzymes. And in part, what's likely happening here is a reduction of SIBO, a reduction of leaky gut, a reduction of molecules, including endotoxins, that leak through and then require the liver to clean up the mess. So not only do we see a correlation, but thankfully we see interventional data that demonstrates we can improve liver function with supplementation of probiotics. And in between those two, you're likely cleaning up SIBO, dysbiosis, leaky gut, or some other sort of dysfunction in the gut. And this is the gut-liver connection. And also, just as a quick aside, every once in a while, someone will remark, I've really noticed that over time, as my digestion has gotten worse, I notice I'm much more sensitive to alcohol. And in fact, I was this way in college when my gut went through a period of being quite a mess. And usually you will see improvements in alcohol tolerance once someone improves their gut health and secondary to that, their hepatic function. So just bear that in mind. Not that we're trying to give people an open license to drink to excess, but I would like for anyone to be able to go out and drink socially, especially for how you can foster social connectivity and experiences with some alcohol involved. Again, not saying you have to do that, but I'd like people to be able to have the lifestyle flexibility to be able to do so. This next meta-analysis looked at probiotics for blood pressure. Again, placebo versus probiotic intervention. And being a meta-analysis of 26 trials, you see different dosages and formulas being used, including lactobacillus, bifidobacterium, Saccharomyces cerevisiae, and Enterococcus. What they found was that at the 2-month or longer mark, probiotics led to a 3.5 reduction in systolic blood pressure, which I would not consider clinically meaningful. It may have been statistically significant, but there's a big difference between what is not mathematical chance versus what is clinically meaningful, especially when we think about this in relation to the other meta-analysis we've discussed in the past that has found hibiscus tea, 1 to 2 cups per day, led to a 15-point reduction in systolic blood pressure. So I wouldn't say that probiotics would be one of the primary interventions to consider if you're trying to lower your blood pressure. And similar with weight loss, this next study, randomized control trial, 100 overweight individuals, again, placebo versus probiotic, they found a reduction of 2 pounds, 1 point of insulin, and an improvement in microbiota diversity. And as great as this is, I would not say this is clinically meaningful in terms of not a primary intervention to consider for improvement of weight. Now, another item that we've discussed as it pertains to body composition is muscle mass and how crucially important muscle mass is for multiple reasons. Not only is there a correlation between muscle strength as you age and your risk of death from any cause, but we also know that muscle mass releases many of these exerkines or myokines when you exercise or when you have adequate muscle mass, and these tend to be anti-inflammatory and immunomodulatory. So there's multiple reasons for which adequate muscle mass is important. So if probiotics can assist with maintenance of muscle mass or strength, then this would be really helpful to know. So again, meta-analysis, placebo versus probiotic, different formulas, different dosages were used. They found a medium effect size, meaning a medium degree of clinical significance with supplementation of probiotics to foster muscle strength and a small effect size for muscle mass. And again, they found that 3 months or longer was the optimal duration of probiotic supplementation to hit these effects. And these researchers postulated at, and we have another randomized control trial that elucidates one of the mechanisms through which probiotics may improve muscle mass and or muscle strength. And this was a 25% improvement in the absorption of the key amino acid leucine, which is a insulinogenic, insulin fostering, and also anabolic amino acid. And remember, some insulin is important because it's a very chief anabolic hormone. It's not to say if you improve leucine absorption, you're going to slip into diabetes. And in fact, I would argue contrary, with healthier muscle mass, you are probably to some extent protected against diabetes and insulin resistance as you age because muscle is a very glucose hungry organ. Now, what they're outlining here is that if you combine mechanical stress, exercising, along with improved absorption of leucine, leucine through the intermediate mechanism of mTOR will stimulate muscle protein synthesis. So important to bear in mind that because probiotics improve absorption, they may help with multiple things. We've discussed iron absorption and B12 absorption in the past, but also amino acid absorption, and that can help with muscle strength, medium effect size, and muscle mass, small effect size. And rounding out our discussion, let's discuss infections. A meta-analysis of 8 randomized control trials, 1,000 individuals, looking at those with acute COVID-19, control versus probiotic. Different probiotics were used, different dosages were administered, and they found, very interestingly, a 63% reduction in respiratory symptoms, a 39% reduction in diarrhea, a 38% reduction in adverse outcomes associated with COVID treatments, but no impact on mortality. So we see a reduction of morbidity side effects and not a reduction in mortality. And part of why researchers believe that probiotics are helpful for reducing COVID severity and symptoms is this bactericidin known as plantasarin. Plantasarin partially blocks entry of COVID through the receptor of ACE2. Now, ACE2 you may have heard of before can be modulated by vitamin D, which is why vitamin D has a protective and preventative effect against COVID. Same mechanism, ACE2, is impacted by probiotic supplementation, as is a reduction of replication through suppression of RNA. So just important to bear in mind that the probiotics do have a multitude of effects, not just consolidated to one's gut. And then the final study here was a randomized control trial looking to see if probiotics will reduce oral dysbiosis and or dental caries and cavities. And they did find a reduction in oral dysbiosis when administering probiotics. It's also important to keep in mind that other meta-analysis data have found a reduction in periodontitis with probiotic supplementation. And part of what researchers here think is happening is probiotics have multiple mechanisms that are antimicrobial. Bactericidins, we discussed a second ago, deuterin, and also biosurfactants, which all discourage the growth, overgrowth, and development of dysbiosis in the mouth, which can then start to have a noxious effect on the enamel and protect against dental caries and cavities. So that is a quick recap on some of what I felt to be the most important and impactful literature published on probiotics. Again, I hope this is helpful. And remember, with better data, you can make better decisions, better outcomes, better health. And probiotics, not a panacea, but a very promising tool that can help with multiple symptoms and conditions, and certainly something worth considering in your healthcare routine. All right, this is Dr. Ruscio. I'll talk to you next time.